Hey, I just have a couple of reflections I wanted to share regarding the 24/25 primary care network DARES. We have created our in-depth kind of initial review on the DARES like we always do. And we also have created our framework to help you identify what you feel like you could focus on in quarter one. So that can be found here in our members club. But for those of you not part of our members club yet, I just wanted to share a couple of insights and a couple of reflections I've been sharing with other people because it just keeps coming up. So the first reflection relates to the new PCN service requirements. So now networks are just being asked to think about and execute on how they are going to coordinate their resources to support and improve resilience and care delivery at both a PCN and practice level. So how are you going to coordinate yourselves moving forwards? What worked well about your journey to date, and what could be even better if, or could you choose 3 areas within your control that you could better coordinate moving forwards? Okay, easy peasy. So the second ask is, how are we going to start collaborating to start to build our integrated neighbourhood team? For those of you that feel like being part of an integrated neighbourhood team, even though it's an ask of the DARES, it may feel like a pipe dream because the relationships within your network are really fractured. I would just reframe that. You know what? I'm just going to use my own terminology in this national contract and just reframe it to say, what 1 to 2 organisations can we start to build a closer working relationship with, or what already exists that we could potentially start to build closer working relationships with? And that may feel a bit more manageable, a bit more doable versus being the front, centre and heartbeat of this integrated neighbourhood team. And I know it's not asking that. It's who can we collaborate with? So let's just start with 1 or 2 organisations. Okay. The third ask is around how can networks improve the health outcomes for their population? So I think to me, that feels like even if your network feels quite fractured and it doesn't feel like you're all on the same page, asking the network to focus on what we can do, what do we need to do to coordinate, collaborate to improve our health outcomes for our patients is a really nice, like centering piece. It brings the conversation back to why are we here? Why do we come to work? And we want to improve the outcomes for our patient. And then the fourth ask is around kind of how, where, when, how much, and how can we best target the resource for the maximum impact. And I really like it. I think it's a really good framework. If you don't have a vision and you're struggling to work together, can you use these questions and this framework to help kind of rally the troops and focus the network on how we're going to coordinate, how we're going to collaborate, how we're going to improve, and how we're going to target resource? So my first reflection is, I like this framework, and I think specifically for the networks which are struggling to work together, and that's okay because we all understand the challenges and the context that we work within, can you use this framework to help you move a couple steps forwards? Okay. And then the second it's more of a question and a reflection, and that is, does your primary care network know its numbers? Do you have a financial plan for 24/25? Do you have a workforce plan? Do you know how much your PCN workforce is truly going to cost? And where are you going to get the money from if you are over the additional roles reimbursement scheme? How are you going to allocate your core funding moving forwards? Now, it's just one kind of lump of money, and it combines the previous leadership and management funding, and it also includes your clinical director payment. I know some of you are going to be watching this will think, duh, of course you've got a financial plan in place, this is basic. And in other networks, they are still working through the 22/23 financial year for a variety of reasons. So I would say, ideally in quarter 4, you would have wrapped up all of your finances. And now you know how much money that you're going to get. You know how your network spends the money. You know where you need to have a contingency. Can we have a solid financial plan which includes your workforce spend moving forwards? So hopefully thinking about how you are going to organise yourselves moving forwards, underpinned by a really solid financial plan that will get you off to a really good start this financial year.